Welcome back, team. So today we're going to talk a little bit about health policy. I've pulled from a couple of resources, again, just like the other slides, I've cited where you can get a lot of the information from this class when we're talking about specific policies that focus on physical activity and nutrition. I pulled a little bit from this book. It's really interesting, called Healing Gotham, New York City's Public Health Policies for the 21st Century. There was an entire chapter about how New York City as a whole needed to lose weight, and how the state, the city, local government, nonprofit organizations work together to change policy that therefore impacted the health of the city. So I'm going to give you some of the examples from that today. But first, let's go through and define what is a policy. Here's your pronunciation guide, as well as I'm saying it correctly. Policy, it's a definite course or method of action selected to help guide and determine present and future decisions. Basically, it's something that a group, a body, a governing body, a leadership body decides to adopt to help direct action, to help guide action and reach particular goals, with the plan of embracing the general goals and acceptable procedures to do so, to achieve some type of outcome. Here is a definition that is an older one, right? 1987. Most of you probably weren't born when this definition was written by Miller. However, it's a definition that I've seen over and over again through a couple of different health textbooks. Health policy is used to define that aggregate of principles, so that whole group of principles that characterize the distribution of resources, services, and political influences that impact the health on population. So again, the difference between a policy and a health policy is that the outcome in which you're focusing is a health-related outcome. So within healthcare policies, policies are created to help define a vision for the future, to outline particular priorities, to build consensus, to inform procedures, to inform allocation of resources, distribution of resources, to set rules and regulations on how certain things should be done, distributed, given out, or set forth in the first place. There are two main types of health policies. There's regulatory, so those are the rules and regulations that are meant to keep organizations in check, or to really set a group of rules, and where those rules can be evaluated or assessed within, from as small as the interpersonal or personal to all the way up to organizational rules and policies. Some examples include smoking bans. If you look at the history of what has helped decrease smoking in the United States, well, the first thing was actually the Surgeon General coming out with a report in 1964 outlining how terrible smoking is for your health. But other things that have been really effective have been policies that have been put into place that have taxed cigarette and smoking, as well as policies as to where you cannot smoke. So take, for instance, up until the late 1980s or early 1990s, you could still smoke on a plane. So there was a regulation or a policy that was passed where you couldn't smoke on a plane, right? And we've seen different policies that have been put into place where you can only smoke at establishments, certain types of bars that serve this percent alcohol, this percent food. Other examples of regulatory policies equal policies related to medical licensure, which is pretty great because you don't just want any old person performing healthcare services on you, and you also want to make sure that the healthcare facility you attend, whether it's a medical clinic or a federally qualified health center or a hospital, has been accredited by the proper governing body. So that's also part of a regulatory policy. And then even just an example of vaccines. I think I might have mentioned before, my whole area of research really focuses on the prevention and control of HPV-related cancers. We know there's this vaccine, the HPV vaccine called Gardasil, right? It right now is a recommended vaccine for children age 11 and 12, but it's not one of those mandated vaccines that you have to get as an adolescent before progressing through school. There have been different vaccines, however, that are mandated, and the only way that you can not get the vaccine for yourself or for your child is through religious or philosophical exemptions, depending on what state you live in. And those policies differ state by state. So that's really interesting because here in the United States, we really do operate as basically each state and even its own and even each territory kind of operates its own like mini country as to how healthcare is carried out, right? There's some similarities, particularly in terms of like Medicare payments, but Medicaid, and that's more of reimbursement. Anyway, I'm going on a tangent. Let's bring it back in. All right, so regulatory are, again, those sets of rules that are meant to help guide the way that healthcare is carried out, right? Allocative is where you allocate resources, you give certain resources, distribute resources, even income or goods. They're the rules that determine how that's done. So there's distributive, where just imagine you're distributing equally to a population, and then there's redistributive, where you're taking something from one group of people and you're redistributing it to another. So some examples could include funding for healthcare facilities. If you're paying taxes, which I'm pretty sure we all are, your dollars, your income, the taxes that are being collected from your income are distributive for the most part, where when there's road construction or when there are healthcare facilities that are built, especially if they're public entities, even paying for public institutions like Arizona State University is partially done via public taxes, right? So that would be distributive because it's a public service, right? But when it's something that possibly is a particular type of benefits program. So take, for instance, SNAP, the Supplemental Nutrition Assistance Program, SNAP benefits, also known as the former food stamp program, but now called SNAP program. That's an example of pulling from, again, the public resource of tax funding and redistributing it to a particular program which services people who apply for and are accepted into the SNAP program. So again, that would be an example of redistributive. Another example is health insurance, right? So X amount of tax dollars are collected, some of which are fed into Medicaid and Medicare. Medicare being for adults over age 65 and some individuals living with disabilities, and Medicaid being for lower income populations, right? So a certain amount of tax dollars are redistributed into those government funded insurance programs. So again, that's just an example of redistributive, allocative policies. So I wanted to highlight, because throughout this entire course, you're going to be hearing about upstream factors as well as this socio-ecological model, which, just to repeat, the purpose of this model is just to inform you or remind you that you operate within different spheres of influence. We don't live in our own little bubbles, or maybe you do, but that bubble is within a family. Or family, sometimes I like to say. I know that's really dorky, but your friends is your family, right? That you're nested into social groups, that you're nested into a social environment, that you're nested within a community, and that community is informed by policy and by the larger society. So where health policy actually targets is more often these outer tiers, the policy and societal level, as well as the community and physical environment. So again, knowing that this is an exercise and wellness group who super passionate about exercise, physical activity, and nutrition, I wanted to pull some examples of nutrition policies and physical activity policies. The nutrition policies do come from Healing Gotham. Some of the exercise and physical activity and nutritions come from this book, and some come from another source, which is also cited on that slide. Some examples could be policies that the U.S. government has decided to say, within these particular commodity crops or cash crops, we're going to help subsidize. We're going to take this amount of taxpayer dollar and buy into this particular crop to make it cheaper to sell. So certain foods such as like corn and wheat and even soy are cash crops. They're subsidized by the government, and so therefore it can be sold for more cheaply for public consumption and for use for other products that utilize those crops. Menu labeling is an example of a nutrition policy. In New York, 90s, early 2000s, this book was published in 2015, but early 2000s, there were policies that aimed at fast food restaurants and certain other food outlets having to label their menus with the number of calories for the food you're about to consume and the beverages you're about to consume. For a while, they started trying to outlaw supersized beverages in New York. I don't know if that's still the case, as well as trying to ban trans fats. But again, these are nutrition policies which were enacted in New York. There were also other policies which at farmers markets made it so that those who were selling their goods at farmers markets started getting reimbursed for the SNAP program, aka food stamps. And so SNAP, those who were benefiting from the SNAP program, SNAP recipients, could actually buy double the amount of produce using their SNAP benefits. And that's actually still going on. That happens here in Phoenix, that happens in Arizona, that happens nationwide, where more often farmers markets accept SNAP benefits and you're actually able to buy twice the produce, just because it can be that much more difficult to buy fresh foods when you're lower income, because fresh foods tend to be a little bit more expensive, right? There are also zoning laws and policies which can help zone and set aside certain lands for development for grocery stores to reduce food deserts, or reduce the impact of food deserts and increase points of sale for fresh food items. And then there also were standards that were adopted where in adult and child care centers, foods had to meet a certain nutritional value to be served at these publicly funded centers for kids and older adults. So some examples for physical activity policies include when Parks and Recreation use some of the government funding and distribute them to offer free exercise classes for community members at community centers. Revising zoning codes and revising zoning codes to try to make areas more walkable by expanding sidewalks, for repairing bike lanes, for installing street lights so that people feel safe walking in the dark. Those are some examples of policies. Regulating the quality and the quantity of physical education in schools is dictated at a policy level. Providing active transportation incentives. So if any of you have ever engaged in any kind of worksite wellness, that's actually at the organizational level policy, where certain, this comes from the Roundtable on Obesity Solutions recommendations for physical activity guidelines that can positively impact people's likelihood of being active. Providing incentives so that rather than driving your car to work and using other parking space, that you're encouraging people to be healthier and healthier employees. Believe it or not, your employer wants you to be healthy, especially if you're buying in to a worksite health insurance plan. Take, for instance, I work at ASU, large university, a lot of faculty and staff. It takes a lot of people to run this organization. I buy into a health insurance plan for Arizona State University. That helps reduce a premium that would have been possibly really expensive if I went out on my own. Because Arizona State is this large organization, a lot of people are buying its health insurance plan. The way that a health insurance company makes money is that they pay out less than they collect. So there are a lot of people working for the organization and a lot of people are super healthy. Well, then they get to collect a premium and the health insurance doesn't have to pay out on healthcare costs. However, if this was a large organization, we paid low premiums, but we were all sick and had chronic diseases, and the health insurance company had to reimburse physicians, drug companies, et cetera, pharmaceutical companies, for a sickly large organization, that would cost our organization more, and that would cost us as individuals more. They'd start raising the premiums to offset the cost of how much they're paying out, right? Just always remember, health insurance, very much business. And so another example, and this is something from the Roundtable on Obesity Solutions, they were actually mentioning in Brazil. I actually spent a summer in Ecuador, and I found when I was there that once a week on Sundays between 1 and 5, or like noon and 4, they shut down the streets, and it's called an open street policy. And the streets are marked off so that cars can't pass. And the purpose is to encourage people to go outside, right? And that actually enhances social cohesion, which is healthy for a community. But to try to encourage people to go outside and to be physically active. That's, again, just a policy that does, in fact, impact people's likelihood of being active and being outdoors. So this is the last slide, but the purpose of this is to say, if you remember in the very beginning of this class, we talked about upstream factors and downstream factors. Where health policy really tries to target are those upstream factors. What can we do to set laws and rules and policies and regulations and distribute resources so that it reaches the population we need to help prevent and control negative health outcomes? So it's really trying to target communities and a more population instead of an individualistic level, like telling people you need to be more active. These health policies and regulations actually try to set the rules and processes in place that would guide healthy living for larger communities. That's all I have, and I will see you guys again soon.